Welcome to Blue Water Health's online education class for patients receiving total hip replacements. Today you will learn about your surgery, what to expect after surgery, and how to prepare beforehand to have the best outcomes possible. There will be a short quiz at the end of the presentation to make sure you understand all of the information. Please be sure to read and listen to each slide before advancing. Preparing for surgery. Hip precautions. Some of our local surgeons will not want you to move your hip in certain directions following surgery. Your surgeon will inform you if this applies to you. It is important that you follow these movement restrictions to make sure you avoid dislocating your new hip replacement. The first precaution is to not bend your hip past 90 degrees. This means you cannot bend down to pick up objects from the floor, you cannot bring your leg up to tie your shoes, and you cannot sit on low chairs where your hips are below your knees. The second precaution is you cannot cross your legs. You cannot cross your legs while you are sitting in a chair or lying in bed. Some patients will be asked to buy a special pillow to use in bed to avoid crossing their legs while sleeping. The third precaution is you are not able to twist or rotate your hip. This means you must make sure to avoid twisting while reaching for items, and you must take small steps when turning. You must also be sure to avoid rotating your feet inwards and outwards in bed. Possible equipment needs. There is a lot of helpful equipment that will improve your independence after surgery. Each surgeon has slightly different requirements after surgery and will provide you with a list of the required equipment. The occupational therapist may recommend equipment for home based on your functional status after surgery and your surgeon's recommendations. This list may include a standard walker, cane, crutches, raised toilet seat, Versa frame, shower chair, tub transfer bench, reacher, shoehorn, or elastic shoelaces. Rental purchase locations. There are a few local stores that you may be able to rent or purchase the equipment from if needed. Please refer to the loose leaf sheet in your total hip replacement booklet for more information. If you are from out of town, please review the stores in your local phone book or research for them online. Local legions and servicemen clubs often have equipment that they loan out for use following surgery. Many patients are often able to borrow equipment from family or friends. Please note that the Red Cross no longer rents equipment. Surgeon-specific equipment needs. A few of our local surgeons will require you to purchase an abduction pillow, as we discussed earlier, or anti-embolic stockings. The pillow is used between your legs while sleeping to avoid crossing your legs. If you are required to have these items, your surgeon or their office will let you know. Definite equipment needs. All patients having a total hip replacement must bring to hospital proper footwear with an enclosed heel and non-slip sole, preferably with laces or Velcro, so that the shoe can be adjusted for swelling in your foot as needed. Clothing should be comfortable, loose, and appropriate to wear in front of other patients. Shorts are best following a hip replacement. People undergoing a total hip replacement will also need a walking aid for use at home after surgery. Generally, it is recommended that patients use a standard walker. Your home. To prepare for surgery, it is also important to modify your home environment to ensure you are safe when you return home from your surgery. If you live in a multi-floor home, it may be easier for you to stay on the main floor while you recover. Since you will be walking with a walker after discharge, it is important for you to ensure you have a clear pathway around your home to allow for space for you and your walker. You may need to move furniture to create pathways, eliminate trip hazards, including items on the floor and scatter rugs. Driving and car transfers. Generally, after surgery, You will not be able to drive for 6 weeks as per your insurance policy. Please get directions specifically from your surgeon regarding when it is safe for you to start driving again. We have listed some advice on how to enter your vehicle on this slide. For more information on driving and car transfers, please watch the video link located on the Blue Water Health Total Replacement webpage. Community supports. Before your total hip replacement, you may want to arrange for transportation. If you are anticipating you might have difficulties, or if you live alone, you may want to look into assistance with meals or prepare meals before your surgery. For more information on how to obtain these services, please visit www.agefriendlysarnialampton.ca. Home and community care. Home and community care are able to help you navigate any concerns you may have after you discharge home from the hospital, including respite stays. For more information, please call Home and Community Care at 1-888-447-4468 or visit eriestclairhealthline.ca. Exercise. Before your surgery, you can do exercises to strengthen your legs and arms to prepare for and make it easier after surgery. Please make sure to avoid exercises that cause increased pain or swelling in your hip. Refer to your total hip replacement booklet or your Seamless MD app for a list of exercises that can be completed prior to your surgery. While in hospital. Parking. Blue Water Health has parking available with a maximum daily rate of $8. You can pay for your parking at the kiosks located in the atrium beside Tim Hortons. Pain control. After surgery, our goal is pain management, not elimination. The team will provide you with pain medication to keep your pain under control and allow you to complete your rehabilitation. It is important to take the pain medication as prescribed by your surgeon for the first several weeks after surgery in order to function optimally at home. Sometimes these medications can cause constipation or other bowel issues. It is important to move around regularly to help keep your bowels moving. Stool softeners may also be required. Please speak with your nurse or surgeon for more information on medication management. Rehabilitation. Your rehabilitation team will provide you with equipment to use while in hospital, including a reacher, shoehorn, standard walker, and the equipment for your physiotherapy exercises. Please do not take this equipment home with you when you leave. Approximately 4 hours after surgery, once your surgeon deems you ready, the nursing staff will get you up and help you take steps to a chair or help you walk to the bathroom if you are able. Occupational therapy. Over the course of your hospital stay, the occupational therapist will complete an assessment as well as review functional transfers, strategies for getting dressed with or without adaptive aids, and hip precautions if applicable, review home management techniques, and car transfers. They will also identify any additional equipment you require for use at home prior to discharge. Physiotherapy. During your hospital stay, a physiotherapist will assess you after surgery to determine how well your hip is moving, how strong your legs are, as well as your general ability to get up and move after surgery. The physiotherapist will review with you the orders from your surgeon and let you know how much weight you're allowed to put on your operated leg. Walking. Physiotherapy will assist you in regaining your walking after surgery. Most people use a standard walker at this time. The pattern is always walk forward first, then step with your operated leg, then step with your non-operated leg. The physiotherapist and rehab assistant will teach you how to do your after-surgery exercises. If you have an overnight stay planned at Blue Water Health, your physiotherapist and rehab assistant will walk you down to a small rehab room day 1 after surgery where you will have ice applied to help with pain and swelling. Teach you how to complete your after-surgery exercises as outlined in your total hip replacement booklet and on the Seamless MD app. You will be encouraged to complete 20 to 30 repetitions of each exercise, strengthening your thigh, bending your hip, and straightening your hip. Your physiotherapist will measure how much bend and straighten you have in your hip and will report that to your surgeon by writing it on the whiteboard in your room. Stairs. Prior to your discharge, the physiotherapy team will practice the stairs with you. The physiotherapist will discuss your stair setup at home and will make recommendations on how to complete stairs safely in your home after discharge. Generally, most patients will be taught to do one step at a time, leading up with the non-operated leg first, then placing the operated leg on the step beside it. Coming down, the pattern is reversed, stepping down with the operated leg first, then placing the non-operated leg on the step beside it. Discharge day. Most patients return home on day 1 after surgery, not including the day of surgery. For example, if you have surgery on Monday, most patients are discharged home on Tuesday morning after therapy. Your nurse will go through all your discharge instructions with you and tell you how to follow up with your surgeon. If you plan on returning to Blue Water Health for your outpatient physiotherapy, your rehabilitation team will provide you with your first appointment date and time before you discharge home. After discharge. Physiotherapy. After you are discharged home, you will be expected to continue the exercises you are doing in hospital 3 times per day. Please continue to walk with the standard walker until you are advised otherwise by the physiotherapist you are working with in the community. Outpatient physiotherapy. If you plan on returning to Blue Water Health for your outpatient physiotherapy, your rehabilitation team will provide you with your first appointment date and time before you discharge home from the hospital. If you plan on attending outpatient physiotherapy outside the hospital, it is up to you to book your own appointment. If you had an overnight stay, you should have your first outpatient physiotherapy appointment booked within 10 to 14 days of leaving the hospital. If you are an outpatient total hip replacement, you should have your first physiotherapy appointment booked within 10 days of your surgery. It is critical that you book this appointment before your surgery to ensure you meet the timelines as recommended by your surgeon. What to expect. Patient-reported outcome measures. As mandated by the Ministry of Health and Long-Term Care, you will be required to complete 3 surveys along your journey with us at Blue Water Health. The surveys are required at 1 week before your surgery, 3 to 4 months after surgery, and again at 1 year after surgery. The patient-reported outcome measures survey will take less than 10 minutes to complete. This information is used to help ensure quality improvement for all patients who undergo total joint replacements. Incision. Your incision will be closed with staples. The staples will come out approximately 14 days after surgery. When you leave the hospital, you will have a bandage on your incision. It is to stay on and is only to be changed if it gets wet or falls off. Your nurse will provide you with instructions on how to manage your incision before you leave the hospital. You can find additional information in your total hip replacement booklet or the Seamless MD app. Please monitor your incision for signs and symptoms of infection and notify your surgeon if you are worried you might have an infection. Please refer to your total hip replacement booklet or the Seamless MD app for a complete list of signs and symptoms of infection that can include increased redness, swelling, and fever. Walking aids. Walking ability after a total hip replacement is dependent upon pain, strength, balance, and coordination. Your physiotherapist will work with you to determine the best walking aid and will progress your walking as you recover. Pain. Please use your pain medication as recommended by your surgeon, rest and ice to manage pain in order to function at home. You can expect to have pain, swelling, and tightness for up to 12 weeks after surgery. Quiz. Thank you for participating in the online education session for your upcoming total hip replacement. If you have any questions, please call Rehabilitation Services at 519-464-4400, extension 8100.